Welcome to NHIS in a week, where we give you updates and highlights of the authority and the scheme. My name is Shanice Palm. Now the headlines. Dr. Da Costa Boaje unveils plan to expand healthcare access. NHIA gets new Deputy CEO of Finance and Investment. NHIA releases 151 million cedis as claims payments to health facilities. And USAID, Propel and NHIA consolidate partnership. To our first story, the National Health Insurance Authority in the Upper West region held its 2024 mid-year review meeting on August 15th at the In-Service Training Center in Wa. The session aims to evaluate the region's performance from January to June 2024 and strategize for the year's remaining months.
Acting Regional Director Samuel Lobalekamwe encouraged district staff to focus on improving membership performance. The region has achieved 74% in general membership, 58% in indigent registration, and 64% in population coverage. Northern Belt Director Titus Sori praised staff dedication and urged them to collaborate with local leaders to combat illegal charges at healthcare facilities. The meeting featured district presentations and an open forum where participants shared feedback and strategies to maintain the region's universal health coverage status by year's end.
Still on review, the Upper East region held its 2024 mid-year performance review at the Ghana Health Service In-Service Training Center in Bolgatanga. The meeting also focused on leveraging partnerships and operationalizing zonal offices to meet end-of-year goals.
Northern Belt Director Titus Sori encouraged staff to strive for excellence and enhance universal health coverage through increased indigent enrollment. Acting Regional Director Abdullahi Kasimu highlighted the region's impressive 77% achievement of its end-of-year membership target, with a significant 14.5% increase in enrollment compared to 2023.
In other stories, at the third Sustainable and Behavioral Change Summit in Accra, the NHIS CEO Dr. Da Costa Boaje outlined a 4-point plan to expand healthcare access nationwide. Key initiatives include integrating the NHIS with the Ghana Card for Children, eliminating illegal co-payments, and introducing mandatory health insurance for visitors.
The Ghana Card actually holds the key to achieving the universal health coverage. We are saying that your Ghana Card is now your NHIS number. So between the ages of 15 and above, if you have your Ghana Card, all you have to do is to obviously link it up with your my NHIS or your NHIS number. Then you can use your Ghana Card to access healthcare services. By saying so, there is a cohort on our database. We have about 6.3 million Ghanaians aged between 6 and 14. They are actually missing in terms of the Ghana Card. So on our budget allocation, instead of us doing our Ghana Card, we said that no, we will link up with NIA in such a way that they will produce this Ghana Card for these young Ghanaians between the ages of 6 and 14. Now, once you do that, Ghana Health Service is currently doing number at birth. So number at birth means that once you are born, some few months, you get your number. So once you do that, you actually covered from birth to death.
The summit focused on achieving universal health coverage through evidence-based interventions and marked a significant step in advancing healthcare in Ghana. President Nana Addo Dankwa Akufo-Addo has appointed Mr. Frederick Gilbert Addy as the new Deputy CEO of Finance and Investment at the NHIA. Mr. Addy, a finance and investment expert and NPP parliamentary candidate for Swaman, takes over from Francis Owusu, who recently retired. The NHIA board and staff have welcomed Addy, who aims to uphold integrity and transparency in his new role. USAID, Propel Health Ghana, and the NHIA are strengthening their partnership to improve health services, particularly in family planning. In a meeting at the NHIA head office, Propel Health's country director, Dr. Demidua, discussed plans to research the integration of family planning services into the NHIS. NHIS CEO Dr. Da Costa Boaje emphasized the importance of this partnership in achieving universal health coverage and called for continued collaboration. The NHIS customer service team underwent a one-day training session on value-based care in collaboration with Farm Access. The training held at the NHIS head office focused on improving patient-related outcomes and experiences. The session is part of the NHIS efforts to shift from a volume-based to a value-based healthcare model, enhancing service delivery across the country. In other stories, the National Health Insurance Authority has released over 151 million Ghana cedis to mixed-tier health facilities across the country. This significant payment is part of ongoing efforts to support healthcare providers and ensure the continuous delivery of medical services under the NHIS. NHIS CEO Dr. Da Costa Boaje met with the Ghana Prison Service to discuss improving healthcare services for inmates under the National Health Insurance Scheme. The meeting emphasized the importance of expanding the indigent population program to ensure that vulnerable groups, including prisoners, have access to essential healthcare services. This partnership aims to strengthen the inclusivity of the NHIS and contribute to the broader goal of universal health coverage. Up next is Preventive Health segment.
Pneumonia is an inflammatory infection of the lungs, typically caused by bacteria, viruses, or fungi, which can range from mild to severe and affect people of all ages, especially adults, children, and those with compromised immune systems. Pneumonia can be prevented through a combination of vaccinations, good hygiene practices, and healthy lifestyle choices. Here are the key steps to help prevent pneumonia. 1. Get vaccinated. Pneumococcal vaccine protects against the most common cause of bacterial pneumonia. Influenza flu vaccine. It reduces the risk of pneumonia by preventing the flu. COVID-19 vaccine. It protects against coronavirus, which can cause pneumonia. 2. Practice good hygiene. Regularly wash your hands with soap and water. Avoid touching your face. Reduce the risk of transferring germs. Cover your mouth and nose when coughing or sneezing. 3. Avoid smoking. Smoking damages lungs and reduces the immune system's ability to fight off infection. 4. Maintain a healthy lifestyle. Eat a balanced diet to boost your immune system. Exercise regularly to strengthen your immune system. Get adequate sleep. This helps your body to recover and maintain a strong immune system. 5. Manage chronic conditions. Effectively manage chronic illnesses like asthma, diabetes, or heart diseases. Avoid sick people. Stay away from individuals with respiratory infections. 7. Stay hydrated. Drink plenty of fluids to keep your mucous membranes moist. 8. Strengthen your immune system. Probiotics support immune function. Supplements. It ensures adequate intake of vitamin C and D. 9. Monitor symptoms. Seek medical attention promptly if you experience persistent cough, fever, or difficulty breathing. By following these steps, you can reduce your risk of developing pneumonia.
Hey, girl, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for internet. But no shaking. I have NHIS already.
After you're on a line, ting.
Ina, look at you. What are you going to do in the office when you can just download the app to register for an NHIS membership?
Yes, my people. You heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Me, Seth, I'm starting work next month.
That's all that we have for you for this week's edition of NHIS in a Week. For more stories, do log on to our website at www.nhis.gov.gh or visit our various social media handles displayed on the screen. My name is Shanice Palm. Do have a lovely week.